Yeah.
Good.
I was talking about the food, and yeah, I've got Penelope Kingston here as well, and one of the vets. So yeah, just tell me a bit about the food, please.
Alright, we're going to talk about Hills Food today, which is one of our main premium brands that we use. So we've got your straightforward range, which is just for your adult dogs, puppy dogs or mature dogs. Then we get on to your more specific ones, which are prescription diets.
Right.
Yep. So there's quite a big range of prescription ones, and they're all for specific disorders. So dogs that have gastrointestinal disorders, we use ID, which stands for intestinal diet. So we have two types of ID. One is just your straightforward one, and the other one is a really low fat one. So dogs that have pancreatitis and that sort of thing can also go onto the low fat one. The normal one's just for dogs that have generalised gastrointestinal upset. So they have eaten something they shouldn't have, or have got hemorrhagic gastroenteritis or things like that. Then things like urinary tract disease, so dogs that have had bladder stones, so they've had a stone removed and then they need to go on to a maintenance food that will stop any stones.
And you recommend that to the client?
Yeah, yep. So after they've had surgery, then we usually put them on CD or something.
And they'll need to stay on that long term?
Yep, you usually try and keep them on it long term just to prevent it from coming back.
Okay.
The urinary one does depend a little bit on which type of stone they've had, but CD's the most common one that we use.
Right. And what about for sort of older dogs?
So,
arthritis?
yeah, older dogs, we usually use JD. So it's really good for dogs with arthritis. It's got your glucosamine and chondroitin in it. And it's also slightly lower in calories, so yeah, they don't put on too much weight when they're getting a little bit older and more sedentary.
And what do they tend to prefer, the dry? Does it just up to the client?
Yeah, it is very much up to the client what they prefer to feed. I try getting them on dry food as much as possible, just because that's better for their teeth. Yeah, easier, less mess, yada yada. Then what else have we got? We've got RD and metabolic for overweight dogs. So they're good for they're lower in calories, make them feel a little bit fuller.
Right.
And then we get to the WD for your diabetics. So they're for dogs that have issues with their blood glucose. It's just good high carbohydrate, high fibre that keeps their blood glucose nice and stable.
Good. Yeah, that's great.
And then what have we got? ZD, which is for dogs with really high food intolerances, so that are allergic to some sorts of proteins.
Right.
So it's been protein pulverised.
And that's the only one of that range?
Yeah, ZD Ultras are kind of the premium of that sort of thing. Yeah.
That's great. Thank you very much.
You're welcome.
Thank you.